Hello, my name is Emily Whiting. My daughter is 7 months old. Her name is Charlotte Whiting, and she has bilateral cleft lip and cleft palate. And today we wanted to walk through a few different feeding systems that I have kind of stumbled upon from suggestions from surgeons, speech therapists, as well as I believe a few suggestions from folks on this Facebook page, and some other things we kind of concocted, my husband and I, to see if it would work to try to make feeding a positive for Charlotte post-surgery. And so we wanted to walk through some of those things and just share what we've seen out in the market. And certainly it's not all encompassing. I'm sure there's other things out there, so would love to learn about other options. I will throw out the caveat, I am not a speech therapist. I'm just a mom who had a really hard time post-op in feeding my child and making it a positive experience. And so, as many of you moms and dads out there know, when your child isn't eating well, you will go to the ends of the earth to make it a positive and to find a way to get your child to eat and to make it a good thing. So hence all of these options that are sitting on the table. It's amazing what you'll do as a parent to make it happen. So the second feeding system, and this is what we were sent home with from Charlotte's lip surgery, her lip adhesion, is a syringe and a catheter. It's nothing fancy. It's literally just a syringe with a catheter that we cut and put on the end. There's all kinds of different sizes of catheters and textures of catheters, and so we really experimented. We found one that is firm enough that it stays in her cheek, but soft enough that it doesn't hurt her. So this works well, and I've got other catheters kind of sitting here that we experimented with and probably will experiment with again for this next surgery to see what works best. With this one, we had a lot of trouble with feeding with syringes, but I have heard that many parents don't. Many parents do well, and I think it was a combination of multiple things for our child that it didn't work out too great. But if you reference the video on tips for positive feeding, you'll see some tips on how to make sure this is a positive feeding experience for your baby. Another feeding system that we learned about here on this Facebook group from another mom is the Tendercare Feeder. So it's a little clear bottle. I think it has 100 mLs in it, which is probably about 3 ounces. And it has this tip. You can probably hear Charlotte, my daughter, in the background. She's agreeing that it's a great bottle. So this little thin tip is kind of like a catheter, just like with that syringe. And then you can just squeeze the bottle. So you do have to tip it upside down to feed the baby and squeeze it in. I think we are going to use this after this next surgery. And we're probably going to prop her up in a high chair to feed her so that she's sitting at a good angle and we can see her and watch the flow. The challenge with this, and honestly the challenge with the syringe too, is flow, because if you squeeze too hard, you drown her. If you don't squeeze fast enough, she gets mad because she's not getting enough food at once. And if you squeeze it too far into the back of their throat, then it gets hard to swallow. So not to scare you all, but that's one of the challenges. So that's another reason why I highly suggest that you practice by feeding yourself, so you get the feel for how much to squeeze, how the flow should be, what the angle should be, what helps you to be able to swallow without feeling like you've got too much in your mouth at once. So this is a really good idea. Oh, and Charlotte's sneezing now. I would also recommend, I think before we use this for Charlotte's next surgery, I will cut this down maybe an inch shorter because it's a little too long and flimsy and it ends up getting milk all over the place. We probably get half the milk in her and the other half is on a bib and on the floor and on me and all kinds of places. So this is a great tool, but I would trim down that catheter end and I would practice with the squeezing. Sometimes I'll just put water in it and just practice till I get the flow right. And then this will work really well. Typically, I'm guessing your baby, I know our baby, drinks more than 100 mLs at one time. So again, just like with the syringe, I would fill multiple of these and then just grab another one and use it to do the full feed so that you don't have a long pause of refilling this little guy each time.